Hi everyone, we are back again with another special episode today. Today is the 12th of April, right?
Yes.
And this is our 12th episode.
Yeah,
How is that?
at the time when we're shooting is the
12th
12th.
of April.
So when it comes out, it's probably going to come out maybe during the week.
Oh yeah, because
You know what
today
I mean?
is the shoot day.
Yeah,
obviously.
yeah.
So I just want to say, guys, we are back again with a bang of an episode. Today we are having our special, extra special. Remember, when you are a nurse in the healthcare space, you come to NBS podcast. You are our special guest. We have our Lerato Mabowa, Sister Lerato Mabowa. Today she's going to be introducing herself. We will be going through herself as an entrepreneur, from being a nurse to moving to being an employer, guys. This is what we are known for, right? We inviting people here. We talk about businesses
Exactly.
away from
Exactly.
bedside,
Yeah.
turning healthcare profession into your own space. You
Yes.
understand?
Legacy. Yeah.
Legacy. Yeah. So I just wanted to say today, I just want to give Sister Lerato to introduce herself today as we are on our 12th episode. Lerato, can you please tell us who you are?
Thank you so much. I'm so honored to be here. Thank you so much, Sister Maureen and NBS, for giving me the platform and the opportunity. And I think I did mention somewhere on TikTok during the week that just you recognizing, yeah, it shows that, okay, what I'm doing is making an impact. For me, that is.
Lucky.
So yes, I am Lerato Mabowa, Sister Lerato Mabowa. I'm a professional nurse and midwife, and I'm an entrepreneur. So normally when I introduce myself, I say I'm Lerato Mabowa. I am a nurse by profession and an entrepreneur by passion.
Okay.
So yeah, I just happen to be a nurse, but then I am passionate about business. I can turn anything into a business. Like that is where I thrive the most. Yeah, that is where my passion lies, basically.
Wow.
So
That's
yeah,
beautiful.
it made sense for me to merge the two passions that I have because they were living in two separate worlds. Yeah, so eventually I needed something that
When you
ties
say
them up.
Two separate worlds.
The
meaning
nursing
and
then the business.
But
Yeah.
the two separate worlds, when you were a nurse and then business, were you practicing business in,
I was
in the same?
I was doing business in another sense. I was doing other types of businesses.
Or you were not doing like medical type of business?
Not.
Okay,
Yeah, this is the first medical business that I have.
What other businesses were you doing?
I was in logistics. I was
Okay.
in supply. I
Okay.
was in. It's not an accident, but I had a IT company.
Oh,
So
Okay.
that is the footing that I got into business
Wow.
in.
Wow,
But then
okay.
Wow.
it's been a long journey.
Are we
been a
talking
long
to a
journey.
nurse here?
You know what I mean? I'm
we're
wondering.
talking
I'm
IT,
wondering.
logistics. Hey, man.
It just so happens that this is one of the things that I am.
Yeah.
A nurse and midwife.
Wow.
Yeah.
Wow.
Yeah, IT, logistics, midwife.
And the IT part of it is something that you also studied.
Yeah.
Oh. Okay.
Yeah, that is the footing that I
You
that could a matric. When I finished my matric, the first thing that I did was IT.
Okay.
And then it was a coincidence, not by plan.
Yeah,
I was
yeah.
lost. Like I went to the wrong campus.
Yeah.
Yeah.
You know, Tax has two campuses.
Yes.
The medical one is in Steve Biko.
Okay.
And then the other one is in Hatfield. So I was lost. It's just a coincidence. So when I got there, I registered for a course by Bitsa Bioinformatics. So because it has bio,
You thought it
It's
as a
bio-
I was like,
medical.
It's biology.
whatever.
Wow.
But it was IT, it was purely IT. It had C Sharp, C++, it has programming, it had everything, and then it had major biology, microbiology,
Okay,
anatomy,
okay.
physio. It was hectic. It was a hectic course. But I'm
Sounds
glad.
like a hectic course.
Yeah, I'm glad I started it because then I met my then business partners who paved the way into this person that I am today.
Oh, wow.
No, but so
Wow.
there is the footing I got off
Yeah.
on when it comes to business itself.
Wow, that's very interesting, eh?
Very interesting.
I'm so, yeah.
A lot of people take nurses, as structured people. Nurses are just nurses. They don't really know much. They don't do much other things.
Yeah.
And then you then tend to realize actually most nurses are smart.
Yeah.
Since we've been doing the post, it's like,
Yeah,
wow.
nurses are not most. A lot of nurses are actually smart. You know,
Yeah.
you just get to be shaped in the healthcare profession because that's where your focus in, but it doesn't mean you can't do any other things. you
Right.
know?
That's
Yeah. So so it's not supply.
Yeah.
Remember, as I always tell people, in the healthcare space, there's all departments. We do have supply.
Yes.
In there, you can be a
Yes.
medical supply, and then you get to be registered with all the SAPRA
Absolutely.
department and all of that, and you supply. So a lot, and we use computers in our offices.
We do.
We actually source out companies, IT companies, to come and structure our companies.
Wow.
You understand?
Yeah,
We
yeah.
don't we do logistics?
We do.
We do.
We
So-
do everything.
You know why I'm saying this? It's like there's nurses, there's teachers, there's police, right? And then there's doctors. So most people would think that those are the smartest ones.
Yeah.
But since now we've been doing the post, like nurses are very smart.
Hence NBS, because we say, come to NBS, let us help you to actually reach into your dream. You know, if you want to, in the business, it's not about opening your clinic, it's about doing any business that you want to do. NBS is just there to actually pave the way.
Structure.
Pave your way into that, and then help you with compliance, the right people to communicate with, you understand, to do it in a space where you are a full, complete, structured
Wow.
business. So
Wow.
NBS, come to NBS, and then you get to be in the logistics.
Talking about coming to NBS, we gotta clap it up for her. Guys at the back, everybody. We gotta clap it up for the first NBS member on the podcast, guys. Gotta give it to her, man.
Clock it. Very important, guys. Last time on our last episode, there was we had a talk about you asked a question
yes.
about
People
what
who
if
already-
someone
yeah.
who's already in the business wants to join NBS.
Yeah.
So this is actually a living
Testimony?
today because we've got Lerato who
Okay.
is already, she has been in a business,
Okay.
but then now she is a member. She decided to join.
Oh.
Yeah.
And looking, because I had to go back to her profile and check, you know, I do that most with my clients.
Got you.
Then I found Lerato having to be more successful. Like, I mean, I would say she's doing well in a business. She's got structured progress already, processes
Yeah.
already. She's got services in her. She's got Section 22 already.
Gotcha,
She's got
gotcha.
a lot of that in
It's
place.
like she's compliant.
She's
Just-
compliant.
Yeah, the
she's
compliance
okay. But she still came to NBS. I think, tell us
Wow.
why you came to NBS, Lerato.
That's
I
a
mean,
good question. Because if I've got a business properly set up and everything is perfect,
Yeah.
why do I then still need NBS, you know?
Because you still need to not account, but then you still have the responsibility to stay in check.
Yes.
So as a nurse entrepreneur, you don't have anyone that you're answering to per se,
Yes.
you know. So you still need someone who has gone through the program of compliance and now knows, okay, Section 22 5 years ago when I did it, it's probably not the same process
Yeah.
as how you're doing it now. And I wouldn't know because I did it that time. So for me to have someone who is, someone who is like a workmate, someone who's going to hold my hand, and someone who I can just call Masala and say, can you now sort this out for me? Because I really don't have the time to do it now.
Wow.
You see, so it was part of due diligence. I needed to find out, am I on the right track? Whatever I started, it is still relevant.
Wow.
You know, because when I started the business, there was no system Maureen to hold you. Everything was just throw you in the deep end and good luck. You know, and then everything was, I found it out the hard way, the better way, the sweet way, everything.
Yeah.
Like I went in without mentoring, without just hope, and like
jumped in.
that is just the person I am now.
After how long being in this?
Yeah.
After how long being in this, by the way?
After
After
long
how
have you
long
been?
being in this did you jump into the business part of it?
I like 5 years or so.
Wow.
Yeah, 5 or 6 years or so.
Yeah.
Yeah. So I don't really have fear. You know, I just me. It's just me and God normally.
Amen.
Yeah, those are the conversations I have with God, and then He says, "I go for it," and I jump in. Then I jumped in, and it made sense. So when I started doing my own research, then I found out, okay, this is what I need to do to start a practice. This is what compliance I need to do, the licenses, the Section 22s, the permits, this and that, and everything just came together. Like I just found people along the way who would be able to help me. And then some of the people that you've had on the show, Abu Sister Lulama, they've been people who I've stumbled across in this journey, who, you know, who have also been like sister hustlers to me. And
Taking
then
you up,
go
walking
Lerato
the journey
Mtuns.
with you,
Yes,
yeah.
yes, yes. Those are the people that I found in the way and said, I come just like you did. They come, Dari, we see that you're
we
on the
support
same
each other.
journey.
Yeah, that's true.
That we are
So
on.
she basically joined for support, for like advices, guidance, marketing strategies, support.
Okay.
I mean, more than anything, it's support, and also to have that company that is there out. It's out there for nurses that is actually getting new information that are there in the market to advise to mold the business. Nurses
Exactly.
business, or maybe people in the healthcare space
Yeah.
business, you know. So, and I felt like, oh, okay, I'm so happy. And then, because then a lot of things in her space is in place, you know. So meaning I still need to have a hand one-on-one with her.
Yeah.
And then just go through the profile and check where we can help her.
Gotcha.
And how do we move forward? How do we empower her? Because she still needs empowerment. She
Definitely.
might have said,
Definitely.
yeah, she might have went through herself and trying to knock on some doors and there's a lot. And she quite have a nice setup of
That's
a business.
prominent.
I really would want to go there. So
Wow.
yeah.
You should take some of the members and others that aspire to open when you go there and check it
Yeah,
out,
I
right?
think that's one of the communication we had
Yeah.
with her. That
Okay.
she's got, you know, I've seen her profile. She's got circumcision.
Yes.
She's
very
got a
excited about
circumcision. Actually, when I invited her to the podcast, I said, Lerato, I want you to dwell a lot on the circumcision because that is where you that is where it's a situation, it's a structure where we know a doctor would have a scissor to cut, obviously for bullying.
Yeah, it's a
What are they
painful thing to imagine.
Come on,
Yeah, you'd never imagine.
Don't be
that,
too
sister.
visual with
You'll
it.
never imagine a nurse
Yeah.
having to do that.
Okay.
But that is allowed.
No.
Medical aiders are allowing us to do it. You just
Wow.
have to go through the training,
Yeah.
and then the right training, the right practicals, and then you do that. So I'm happy to actually.
Before, look, I want to ask a question, right? Talking about cutting and stuff like that. I saw a podcast the other day, and they were talking about the idea of circumcision.
Yeah.
And apparently, I don't know if this is true. I want to know from nurses. The circumcision is good medically, right?
Yeah.
But apparently, it takes away the G spot for a guy.
What do you mean?
The G.
Lerato, I don't understand this guy. What do you mean?
please, maybe if you understand what I'm trying to say.
It's a misconception, man.
It's a misconception.
It's a
like the G spot,
misconception.
like
I
that,
don't know.
that thing that makes guys really enjoy intimacy. Apparently, circumcision, it takes that away.
No, isn't it the other way around?
I don't know. I don't
You know what? The problem is that people
is the other way
circumcise
around,
at an
right?
early age. People circumcise at an early age, so there's no before and after type of situation where people really know what it would have been like. And then the people who don't circumcise, they're happy with that. But then if you do get the recurrent swelling, the recurrent, STIs, all of that, then it's not really worth it because now
That's why
it's
it's
not
good
really
medically.
enjoyable.
Yeah.
It's not really enjoyable anymore.
Absolutely.
So they would benefit more from the circumcision, and they would be, without the swelling, without the bruising, without the sensitivity, then
Swelling. What are you talking about?
swelling.
Okay. Guys, am I a nurse? I mean, I'm confused.
She's dealing with.
Do people who don't go who are not circumcised, do they
There
get
are many
swelling?
reasons why. There are many reasons why people circumcise,
Yes,
right?
okay.
Then
yes.
the circumcision itself is to remove the foreskin and to expose
So
that
swelling
glands.
is part
Ne?
of
So
the
if-
contraindication?
No. But the swelling is one of the reasons why we would have to do
To do
a
circum.
circumcision.
Okay,
Yeah,
alright.
so if you have conditions like phimosis is the retraction, it doesn't go over the head.
Okay.
So it doesn't go over the head, meaning that it's hard to go inside and clean it.
Yeah.
That is a breeding ground for germs, for bacteria. It becomes,
alright,
so that is where the
okay.
swelling comes in. That is when the discomfort comes in. That is one of the reasons why you would absolutely need
to
a
do it.
circumcision.
So it's actually a need more than
Definitely.
yeah.
Yeah.
Definitely.
So there are instances where it's just cosmetic or religious or traditional, but then
Okay.
there are medical reasons why you absolutely
medical
have.
reasons, actually.
Yeah, absolutely have to do it. So
Wow.
Yeah.
All right. Okay. I mean, I've never been in that space. I'm so happy you are here, Lerato, because I know that
Yeah.
it's part of the services that is actually authorized or allowed
yeah.
for the registered nurses to do it, right,
Yeah,
Lerato? Because on
100%.
that space, I would love to know what one needs to have in place in terms of compliant to be able to be qualified or authorized to do second. I know it's not. You don't have to have. Do you have to have Section 22 for that?
You need, because I'm a midwife, so I got the Section 31, the Regulation 31.
Okay.
That,
Oh yes,
yeah,
yes.
that
for
will
midwives.
give you a permission to use things like lignocaine.
Yeah.
You know, the numbing agents. So you do need somewhat of a license and a permit to
Okay.
continue into that space. When you're doing the traditional circumcision, the traditional we mean, because the one I do is assisted device. Ne?
Okay.
So the stitch-free, the sutureless one. When you hear about a stitch-free, you've never heard about a
never heard of
stitch-free circumcision.
You know, I would love to put the stitch free into practice right now. I want to understand what actually when you cut and then there's no blood, nothing.
There's no blood, there's nothing. You just tissue glue, you wrap it up, and you call
You
it.
cut
a-
with what?
Okay, I'll explain it now. So I've partnered with a company called Unicirc. Ne? Unicirc is a assistive surgical device. Great company. It's great in a way of it's new technology in the circumcision space, and then the doctors who have founded it or invented this device
machine,
have
yeah.
spent so many years trying to go from things like plastibele, all these other circumcision devices that we used to use back in the day that are necrotizing. I guess they used to just tie up the skin and it falls off at home and all of.
Yes.
So now they've innovated and they've worked on it and they've come up with one of the best solutions to circumcisions right now. You don't need electricity for it. You just need that device in
does
that
it work?
pack, and then you're good to go. Okay, so this is how it goes. I wish I brought a pack with. So it's a device that you put the tube over the glands, the head, and then when you close it up, you can what is the word for this? You can seal the skin.
Okay.
Where you've marked, you seal the skin for about 5 minutes. It crushes the skin together, forming that the diathermy effect. What you
Okay.
would do to close off the arteries,
The
to
coagulation
stop
kind
the
of-
to coagulate the area. Then after 5 minutes, that whole area is necrotized, and then you cut over it. Then when you remove
it's
that whole
pain-free?
thing, it's pain-free. Okay, there is some pain, but then it's not excruciating
In
pain.
pain, yeah.
It's very the comfort is relatively, with the other circumcision, because you have to go over it and suture. So there's less swelling, obviously there's less healing time, there's less bleeding, and
And how
less
long?
screaming.
How long? How many
I
minutes?
take-
How long?
I take about 10 minutes to do it. Yeah, like I can see so many patients. I can see so many
And
patients.
then if somebody
in
then
one
comes and
day.
then chops, like they can go to work tomorrow.
They can go normally
I think they will
3
get-
days or so.
yeah, I wanted to say
yeah,
that
but then
It's no longer that 3
my-
months or 3 weeks anymore.
the mothers of the boys that they come tomorrow on phone. I was like, I don't know what's happening, or if you did circumcise this kid or what, because he's on his bike now.
He's playing.
Yeah, it's like life is.
Technology is beautiful when it can make
Wow,
things easier.
So when
right?
you
That's
go
so
home,
amazing.
when you go home, you just have to do your basic wound care. On that
You
first
teach
day.
the mothers on how to care for post.
You don't even have to do anything. Yeah, you don't. There's not a lot of post care on that wound as long as you keep. Remember, it's sealed. I put tissue glue and then hyperfix and a bandage. Then you have to just keep it like that.
Yeah.
And it can't make a
Until-
mistake.
Yeah, until I come back and open it in 7 days. So
Okay.
you'll have some mothers that don't even come back at 7 days because it's already healed by that time.
Yeah.
You will get some people who come back and then there's a bit of swelling because the kid was curious and this happened and that. Yeah, but then otherwise there's nothing there. There's nothing.
Wow.
Yeah, about 7 days they are right. 14 days. I've never seen anyone in 14 days. The treatment follow-ups, 7 days, 14 days, 28 days. I've never seen anyone 14.
So
I've
do you
never
have
seen
a
28.
doctor that you're working with?
No, you don't need a doctor because you don't need to use a diathermy. Ne?
Yeah.
So the doctors themselves, they will train you. He's a urologist who train you, and then they are the ones who have certified me to train. Remember, I was speaking now about the Lerato Institute.
Yeah.
So now I'm a master trainer for UNICEF. So
Okay.
I will be doing the trainings for
For circumcision?
Pretoria. Yeah. So I will be doing the trainings for Pretoria because they are situated in Cape Town. You know, we are cutting down expenses of accommodation, the
innit?
flights,
But
the
what's going on here?
NBS. It's like, no. NBS members already having a new thing that they're going to be learning now.
Lerato, you are a
Yeah.
member of NBS.
I am a
And
member.
yeah, fully paid member, by the way.
But
you know. I'm so happy because this says a lot. You know how many people I have on the list for circumcision? And I'm so happy because we have a member that we will be partnering with on these programs.
Yo, this is gonna be
Who's
so
bringing
exciting.
something new also?
This is gonna be so exciting. Like I said, you don't need a partnering doctor per se.
Yeah.
You only need that device. That device comes with the whole pack. The
the surgical
clamps.
pack,
Everything.
the
that
cleanser
pack.
and all of that.
Everything, it comes with that pack. And then the training, I will do it for 3 days. So the first day, we do theory and a bit of dry modeling training. And then the 2 days, we have to push. I need people to do 10 circumcisions before I certify that they're competent. So it's more of a competency-based training. I need to see you in 10 sessions that you are actually able to do it. Then you'll get the certificate to be a provider. You see, so in that 3 days, you must have done 10 circumcisions and we must have gone through all the theory.
Wow.
So one of the prerequisites is that you must have done that that Knowledge Hub VMMC certificate.
Yes.
Yeah, that is the prerequisite. And then obviously you must be a healthcare professional, either nurse, dentist, doctor. And
This is a very new device.
yeah, it's been probably like 6-7 years.
Oh.
But then it's registered with SAPRA, it's registered with the SPCSA.
Yeah.
Yeah, the course is also CPD accredited. You get 30 CPD points for that,
Nice.
you know.
Nice.
So yeah, everything is on point. We are ready to.
So have you started with your first class, or you are working towards your
Yeah,
first
in May
class?
there will be our first class.
first
So
class.
I will definitely send out the communication when it comes to that because I've been just busy with finishing up the setup.
I would love to have a separate meeting so we can align that proper. I
Yeah.
just need to have some. I don't know if we'll have enough time for me to understand because you mentioned about you having to be trained to be a provider.
Yeah, I have to be. I had to be
Lerato
trained.
Institution,
Lerato
Lerato
Institute, yeah, is
has
now
been,
a provider.
Is now a provider, certified by who?
By UNICEF themselves.
Which is the company
The
that
company
is
that-
providing
that
the
provides
machine.
the-
So then the accreditation will be under them. The certificate will be their certificate.
Yes,
All right.
100%.
Okay.
So I will be the one who's going through because I've been doing with UNICEF. We've been going to Cape Town to do training for Unjani sisters.
Yes.
So I've been learning how to go through the whole program with them as a certified master trainer. So now we've gone through all of that. We circumcised from babies, newborn, up until the ages of 70. I think the oldest patient we saw was like 78 or 80 years old.
Why is he doing it?
Medical reasons. What?
I'm just saying.
Medical
You're 78. What are you going to do?
Yeah.
medical reasons. Medical reasons. But then.
Okay.
Yeah. So. Yeah, the UNICEF certifies their own providers. There's
Okay.
not a lot. Yeah, there's not a lot of until. So I need to, after I've trained you for the 10 sessions, I need to just go back to them and say, okay, this is the proof that Sister Maureen is competent.
yeah.
I've done 10 sessions with her, and do they need the certification? And then they will do the certification on their side, register you on their database, and put you in the system. So I'm a service provider for UNICEF. Basically.
Well done.
Yeah.
That's beautiful.
Beautiful, yeah.
Okay. So yeah, let's materialize. Let's make sure that one happen. That one I'm going
It's
to.
very important.
Yeah, we will definitely have to have a separate talk with regard to aligning that. I'm so happy. I just feel like I'm owning this because she's my member, you
Definitely,
know?
exactly. That's why the
We're taking it to
importance,
the world,
the
yeah.
importance of NBS, you realize that it's these visionary individuals that comes together to bring minds.
That's very smart of you. I'm so proud of you.
Yeah.
I'm so
Thank
proud.
you.
If you are so brave to get to there.
How did you even come across that?
Trial and error, like I said, like everything. I mean, I
Trial and
do my
error.
own research.
But
so.
she used to cut the baby cot in.
Yeah, I'm a midwife.
She's a
so,
midwife.
Hey,
No.
Yeah.
Not let alone there. Not alone only cutting.
Yeah.
The normal deliveries you also cut. What do you what?
Episiotomy.
Episiotomy.
Okay.
Yeah, that's another language for you, my man.
Okay, so you told me. Got it.
Yeah,
but
that's
also,
when that's when someone is going
Yeah.
through normal delivery,
Got you.
and they extend the passage
Okay.
with a scissor to if the baby's head is big. I mean, I'm not a midwife. I'm a theater. Yeah, but I hope I'm explaining this right.
Yes.
Yeah. Then they will go and they are trained. They are trained as registered nurses to go and extend that passage where the babies come in. So they will be.
The look on your face.
these cutting parts of G.
And that is even worse than maybe the circumcision, this technique you have
Yeah.
for the circumcision, because that one after that they suture, they have to suture, but they would have injected local anesthetic.
yeah,
It's not like
yeah.
they don't put anything to localize the area. It's not painful
Yeah.
then, but when that
When the healing process of
medication
it,
is
yeah.
wearing off, I think that's where the pain
That's
is
where
coming.
this, yeah,
no?
it's,
Okay.
it kicks
Yeah,
in.
yeah, but
I
I think
want to ask you, ladies, as nurses, right? When nurses come into leadership positions, businesses and stuff, what is it that is so special about them that they bring into the business that they can actually be successful? Because a lot of nurses would be like, I'm afraid of starting a business. I can't start a business. All I know is nursing.
Yeah.
So what is it that would be so special as nurses you think that you bring into the business world?
Let me quickly take this one. I'll give Sister Lerato
Yeah.
an opportunity to answer on her side. But Mina, I just want to say, for the time I've been in the business, I want to actually acknowledge nurses who just come with business ideas, because in school we were not taught business.
Sure.
So if you in the class, there's no module, and
Yeah.
that will be talking to you about how the business, financial, what
Nothing.
there isn't. It's just more
Medical.
biology, medical, and all of that. You learn about how to nurse a patient, different types of condition, and all of that. It ends there. The procedures, it ends there. So when you now start structuring and putting a full structure of a business in place as a nurse, I want to say shout out to those nurses.
Right.
That is a big step. It's a big step
Yeah.
for someone to think, because there's a lot of things that comes with that, and a lot of people don't know. Sometimes I'll just sit down and say, hey, go wisha, go wisha as a businesswoman. Go wisha. You need to make sure that your HR structure is in place for the pay slips, for the IRP5, for all of that HR related issues. Your Department of Labor, your finances.
Hey.
There's a
Just
lot.
like the Raymond Ackerman book, The Spread to Catch a Mackerel, there are 4 legs to a table.
And he always wanted me to buy that book.
If you want to start a business, you gotta make sure you read that book. Yes, I did say I'm gonna get it for you. Next episode, I'm definitely getting it.
That would
I'm
be
gonna
lovely.
come
Maybe
with it.
get 2 copies for
I
Sister
also
Lerato.
need a copy. Like,
Yeah, Raymond Ackerman, the founder of Pick and Pay, right?
Yeah.
He wrote that book, and the way he laid it down to explain business needs is exactly what you're mentioning.
I'm telling you, someone in the healthcare space, let me just be specific, nurses who comes with that idea, I salute them. I acknowledge them. I respect them.
Definitely.
Because it's not a child's play. It's not a worked shift where you get to be given your 7/7 shifts.
Right.
You report to someone.
Yeah.
There's someone overseeing you, what you are doing. Everything you do, you go and report. Can I? This time you're making decisions. You're making sure things are, and you make wrong decisions. Everything is gone.
yeah,
just
it
like
has
that.
a ripple
Everything
effect.
is gone. So for nurses who comes to take that, who have that liver to go into that, to say I'm doing it, I actually, including myself,
Yeah.
I sometimes just sit down to say, hey, I'm paying 20 people permanent every month.
Yes, sir.
I'm waiting. There's a payroll for permanent 20 people in my space. And I've got over 500 local nurses that we issue pay slips.
Yeah.
Guys, shout out to Maureen
Powerhouse.
Talking.
You know.
You guys are gonna make me do that
Doing
fucking
big-
thing now.
Yeah.
The
This is the
Guyleys.
third time you're doing it. I don't want to do it.
The Guyleys challenge.
You know what?
On your side, what do you think?
Yeah.
On my side, it's not for everyone, eh?
Yes.
It's not for everyone, just like entrepreneurship is not for everyone. It's two separate worlds, really. I think
Yeah.
one of the guys was telling me that you don't look like a nurse. I was like, yeah, today I'm working on the business. I'm not working in the business. So there's two different Leratos. One is Sister Lerato, and it's the Sister Lerato who's a clinician and midwife or what. Then there's Lerato, who's the businesswoman and who runs the Royal Lerato private clinics and whatever else is happening.
Yeah.
So those are two very different people. Like I switch up so fast when I have to bipolar or a personality disorder or something, because now you have to tap into both worlds, and then there must be a point where they combine and they become one thing. It's hard for people to become nurspreneurs. It's not easy. It's not easy because
But there must be something special that they carry that makes them flourish in business.
it's gonna be the skills, obviously the skills, the knowledge, the qualifications. That's where you start,
Gotcha.
right? Yeah, you need to
And
already
also to
have
add on,
that.
Sister Lerato, what I always tell people, do business within your area of excellence. Your
Oh,
expertise
yes,
matters.
yes.
Your expertise matters a lot. I mean, you can't be a nurse and now you start now doing after hours classes teaching Banaba Skolo. I mean, you rather would teach nurses.
Yeah.
Yeah, your choice is
Or
very
affiliate
important.
marketing.
Yeah, so, I mean, you can't go and start now. Okay, Lerato has just she's got that gift because she has been in different spaces, but she came back to realization that it works well within my space. She went to logistics, she went to IT, but now she's in her space where she is comfortable. She was taught to do what she's doing now for
100%.
Yeah, she went to school
100%.
for that. You understand? So
Okay.
it helps. It helps,
Gotcha,
and it
gotcha,
gives
gotcha.
you that confidence. You understand?
Confidence. Okay. You
Yeah.
were saying it's the skills?
Yeah, it's the skills, the knowledge, the skills, the knowledge, the qualifications. That's where
Yeah.
it starts. Then you have to have the grits and the you know, the willpower to actually make it work, because it's very cutthroat out there. The red tape is mad, as you know. It's not easy to. There's a lot of barriers to entry. So you need to have a thick scars, thick skin, thick everything in jail.
Backbone.
Just have.
And to think about it, nurses carry those qualities, especially when you look at their work criteria. Long working hours, right?
Yeah, resistant, say,
they up and down, they gotta run. The very attention to details so that you don't make any mistakes.
Yeah.
Those are the qualities that a business really needs.
Yeah,
You know
and
what I
if you
mean?
go into your clinical setup, you'll actually realize that you're already doing, or you're already making the decisions on a daily basis. Whatever it is you need to do as a CEO or as a clinician out there, as a private practitioner, you're already making those decisions on your own. Go MOU, you're the one who assesses the client, you're the one who decides on the care, you're the one who does the nursing care plans. You already, whatever you would be doing outside there is already in your
Literally.
day-to-day work function.
Yeah.
So you just have to now trust your scope of practice and trust that I am licensed, actually.
Yeah, I
You
can
know,
do
there was a nurse who asked me, okay, what is it that I need to do to start a practice? Your license is already paid. No, I don't have a license. I'm like, your license is already paid. Our license things. I'm like, you paid sunk, right?
African
You already
Nursing
have your
Council.
annual practicing license. So your license is already ready. So now you have to get your practice numbers.
Yes.
She was gobsmacked. She's like, what? So the license is this license. I'm like, that is the license.
You're a
That's a
business.
knowledge.
You
That's
are
a
a
knowledge.
business.
Yeah,
A
you
lot of
have your
nurses
own
don't
scope of
have.
practice,
Yeah.
right?
Wow.
That is what leads you and guides you, not a doctor,
Yeah.
not the CEO of not hospital, not that is what guides you. That is your
That is very
template.
true.
Same
That
with-
is where your start and beginning.
Yeah.
Exit or mission. They tell you what to do, what not to do.
Correct.
What if
Yeah.
you didn't do this? This is what happens.
Before
Same-
I forget this, sorry,
yeah,
sister. Ne?
it's
Okay,
okay.
no, you continue because I'm
I wanted to
shifting
just
from that.
attach this to what the statement she just
Yeah.
gave us. Same as to section 22. It comes with annexure. It comes with guidance. The medications that you're allowed to keep in the clinic. the ICD-10 course, the conditions that as a nurse you
So
are
you're
allowed.
running a business as
Yeah.
a nurse, Kahle.
Yeah. So it comes with that. So someone
you.
would still call me, Sister Maureen, do I need a dispensing license to have a Section 22? I said, Section 22 is your dispensing license. They had already lined out what you should put in place. You know?
They're waiting for Sank to tell them, go do it, and there's nothing like that. But then Clicks already figured it out. This cam is already doing it. But the little nurse practitioners inside all of their clinics and
Taking
pharmacies.
business away from us, I'm not
Eh,
happy.
but yeah, so now you question when as a whole nurse, you're resistant and you're reluctant to do it. Whereas someone who's a non-health professional
Thank you.
has a clinic and hires
Non-clinical
you.
person, yeah.
They hire you
And that's
because
what's
when
been happening in many
you're
years, right?
comfortable being under an umbrella of some sort.
Yeah.
You're comfortable because
goodness.
you need to have that skin of autonomy. You were asking me, or what is the requirements for you to enter into nurse practitionership? You need to have that backbone, autonomy. You need to be someone who's standing.
You really need to realize
in silos,
yourself.
go to trust the weeds. This is where I end. This
And
is
this
where I
NBS.
start. Versus.
And this NBS.
And this NBS.
Right now it's easier.
I got
It's
NBS
easier.
thing. She let her breastfeed. I wish.
Talking about
Listen to her.
NBS.
No, she just insulted me now.
What did you say?
NBS.
It's not an insult, it's a compliment. I want to ask you two ladies a question. This goes to so many women
I don't
that
take it as a compliment though. We're gonna go back to it.
there's so many women that I've met in NBS.
Because you know what, it hit
Yeah.
hard because I feel like part of me wants to believe that you are telling me the truth. You want me to, that is the truth because I think people are leaning more on Maureen.
Yes.
You understand?
Yes.
A lot of people feels like, and it's not a good way of teaching people, if I were to say.
Ooh.
I'm telling you, because now
I get your point.
Yeah, now with the recent situation I'm in, which I cannot disclose now,
Yeah.
I feel like yes, when she said I'm breastfeeding these people,
Yeah.
which I came in a space
People can
where
be complacent.
I came in an
Complex.
angle
Yeah.
of wanting to hold my colleague and say, hey, let's do it.
Yeah.
But I think a lot of people are taking advantage now.
You don't want babies, you want bosses around you.
I want Lerato.
Yeah, because at the end of the day,
And-
Masala I can respect it because I know making a permit is not child's
Yeah,
play. It's
yeah.
not child's play. And for her to say, I'm going to get it within a month, I'm like, oh,
yeah.
power to you.
Yeah,
Good luck
yeah,
with that.
yeah.
Because I know already the effort it comes. I know the document that you're supposed to send,
Yeah.
Yeah, the quality of document that you're supposed to send to her. And
Yeah.
every, I already went through that
Yeah.
process. So now that's why I can delegate comfortably. I'm like, rather you than me, sis.
Yeah, but also I'm taking this as a learning curve.
Okay.
Because the last episode, I
You
don't
want
know.
to clarify what is it that you feel like
Not now.
is holding you
Not now, but I'm
tight?
not feeling all right with few members.
Few members.
And,
Sorry,
Guys, it's not my intention.
They're not working
As
as
in,
hard as you
I was
expect.
just saying.
Yeah, then when I entered here this morning, Lerato said to me, "Oh wow, sorry." That was when I was explaining.
Oh,
He says,
this,
okay, Rengalu wena."
Oh, boss. So.
Rengalu wena. Because it's more like she could see from a distance, maybe from long ago, that I wish Maureen could just change how she does these things and re-channel it to this side. you know.
Okay.
Because I feel it at the
Okay.
moment. I feel it, and I'm not so.
You are pulling more than they are pushing themselves. Is that what you're saying?
I think, as she has mentioned, that it's not everyone who will tend to be a business person. I think, to me, it sits in a space where I feel like some people are not ready. They are being forced to be ready.
Got you.
Yeah.
You understand?
Which is not a bad thing also.
Yeah, it's like taking a cow to the river and you force that cow to drink water.
Yeah.
But the moment that cow is thirsty and it sees water, it must just automatically go there and drink
Gotta
water.
come to the party.
Yeah,
Gotta
you
come to the
understand.
party,
But then it go to a point where when you sit down and look back to say, okay, I've helped this person.
Yeah.
I supported this person financially.
Yeah.
I've supported this person in the market structure and all
Yeah.
of that and all of that. Put things in place. But then I'm so scared, man. I feel like there will be an answer to say, hey, but Maraka Okopela, you just wanted to do it. You understand?
Crazy.
That's where I'm sitting at the moment.
Got you.
That's why I took a point.
It's like you're obliged to do it.
That's why
Yeah.
where I took a point where you said, Maureen, 2.5,
Yeah.
2.150 for registration,
Yeah.
for everything that you are doing.
Yeah.
Go think through. So,
Yeah.
but Lerato was safe because they've registered already got 2.5,
Yeah.
and I would give that. I would give a free
Yeah.
a payment, like a free registration situation for people like Lerato.
Got you.
I think they
Dedicated
deserve
people.
it more
Dedicated
than someone else. But
Yeah.
I've learned, hey,
And
I've
also,
learned.
the more the price goes up, by the way, is the more you actually get really, really passionate and people really want to do it,
No,
right?
luckily now there are a lot of companies that are actually coming in
Yeah.
to make it more like, I don't know what to say, like more, not it's very professional, but
Yeah.
to
Make it more
assist.
structured and more.
Good
yeah.
word. More
yeah.
structures in all ankles, in
Got you,
different
got you, got
departments.
you, got you.
So it's more going to be something that is just a well-structured
Got you, got you,
organization
got you, got
that
you.
helps
Yeah.
people from HR, from accounting, from bank account, from finance, from all of
Everything
that.
that
I'm
has
not
to do
going to
with
be
business.
involved. I'm just going to be there and then
Beautiful.
people
Yeah,
running it.
beautiful.
I think that is that because I
Before
think
we
my heart
move-
is also working
Yeah.
against me at the moment.
Wow. Before we move, now somebody is watching this. Is like, oh, okay, but okay, NBS. Okay, I understand that you give us all the support, and we submit ourselves. And now you're saying that other people are, not really pulling their socks enough, right? What is it that then you would say as an MBS member you would expect from them?
I think people need to be psychologically ready and they need to understand the entrepreneurship structure first. I think maybe let's do more of event summit where you just explain how these things works. And then because
Maybe a course on
A
entrepreneurship, a
course.
3 months course on entrepreneurship
yes,
should
I
be
think
part of NBS.
those are the things that we are putting in the
Got
space
you.
because people see Lerato she posts videos, she showcase her processes,
Got
like
you.
her services and all of that. People don't see what she's doing; they see money. They see what she might be. She's driving. She's now wearing LV.
Okay.
Okay, I didn't see that. Lerato.
Sorry, Lerato.
Okay,
But
cool.
that talks
You
like
gotta be my friend from now on. I want LV friends. Where's your LV? I know you're always wearing Gucci. Where's the Gucci today? Okay.
I gotta, one of the things that that is happening is that people go in and then they get sold the end result.
Yes.
They get sold the product as a complete unit.
Gotcha.
And then once they leave there, they now realize, okay, so now I was sold this bottle of water. But then where, how? So that is where they become stunned to go to, okay, now I'm holding Sister Maureen responsible because she
yes.
said there's water there, then the whole bottle is sitting there. And then she said it's possible for me to just put it there at an 6 or 7 rand.
Yeah, and
So
then
now
they see
when
money
you have
more
to
than-
go into the process itself,
It's
they're like, yeah, that's where the reluctance come in.
So that is very right, Lerato, because we've got over 80 members, and we can see what Lerato is saying through the facilitation currently. That there will be on 80, there will be about 20 people who are like cooperative, like they are interacting.
Got you.
They want to know what's going on. They don't have a problem when you say, "Hi, no, you need to pay for this service. We don't do it for free." There are those who said, "Hi, I pay 2.5, 2.150. Therefore, I need to be given all of the services for free and all of that." So yeah, that's another thing. But we are doing well. We still have people who wants to
Right.
join, to be members, to be entrepreneurs. They want to understand the whole
Exactly.
structure and all of that. But the problem is that, please, people, everyone in the healthcare space, if you want to start your business, do not look at the end results. Do not look at money, value. Come to NBS. Now we've got processes where we sit with you and we want to understand, are you ready?
We assess you.
We assess you.
Yeah.
What do you have in place? Have you the challenges that you might face? Are you aware of that?
Give you the
understand?
reality.
Yeah, because
Yeah.
a lot of people have started, but starting is another thing. Did they maintain that? Is that successful now? No. You understand? Yeah. Yeah.
Well, now, ask our sister what she expects from members. You as a member, what then do you expect from NBS?
Well, I'm not a conventional member, so for me, one of the things that drew me to NBS was the SAPRA license because it is killing me, that process. So they ease my processes, really. They make it very easy. I just called Masala during the week. She said, no, I can get you the permits for the institute within a month. I'm like, I could kiss you.
So,
So for me, those are the things, like just to help ease my processes.
Got you.
They've done their due
and to
diligence.
say today's to say this on camera, it's not like Masala would go to SAPRA and get SAPRA for her. And
Okay.
There's processes.
Yeah.
There's processes, but what NBS come in as those processes. She pays attention to all the details.
Got you.
The SAPRA license. So Akiri's Sister Lerato is practical. She's got her clinic. She's busy. She needs to see patient every day.
Got
Some
you.
of the things, the manuals that you need to submit to SAPRA, we come in that space and then we guide you. What do you want to supply? And then we advise you. If you want you want a SAPRA license for supply. By the way, there's 3 licenses in SAPRA. There's supply, there's manufacturing, and there's wholesaler.
Gotcha.
So you'll have to know which one do you want to do. Do you want to be a wholesaler? And if you want to be a wholesaler, what do you have to have in place? If you want to be a supplier, this is 1, 2, 3 you have to submit. This is the products that you need to submit to SAPRA. This is the barcoding. There's a lot, which we come in that space. And now, the 2.150, it's very little, Lerato.
Yeah, no.
Just for that
I'm
one
joking.
thing,
It is.
I'll pay
And she
big
never had
money
a
for
problem.
that.
She said, "Oh, okay, let's pay.
Let's get it done.
Yeah.
Before we go back to the questions and go back to the business, right? I want to ask you two ladies a very important question, which I've been noticing with a lot of members and a lot of people that are interested in business. The summit. We go to the summit. You meet people who tells you the same story, right? And before I even ask that question, don't forget, like and subscribe and make sure you follow us on all social media platforms. It's very important for you guys to take notes.
Yes.
You know what I mean? It's very important.
Yeah.
Do subscribe. And also, if you are watching this and you think you subscribed, you probably didn't. Check again. Subscribe. Put a notification bell. You know what I mean? The thing that I'm seeing is most nurses that wants to do business, they do business and they are still employed. Now, that is not an easy thing as a person in G.
Yeah.
And you two ladies, I believe you're also a nurse, right? Also running this NBS. Also the same.
Yeah, but I'm not in practical. I'm not practicing as a nurse anymore.
Okay.
Yeah, now I'm fully an entrepreneur.
Okay, I think when I met you, you were practicing.
Yes, I was still practicing. Yes.
Are you practicing?
As a
Nurse.
In my
As a nurse?
I'm still working.
No, she is a business owner, but
Yeah.
she's practical in a business.
Practicing
But she's-
in your
Yeah,
business.
she's
In my
no longer
practice.
employed by the hospital.
Employed by
she's
the
no longer in
hospital.
the bedside nursing.
Okay.
Yeah.
Now, the question I was gonna ask, right, is seeing a lot of women who's like, you know what, I'm starting the business, but I'm still employed. You know what I mean? What?
It's not gonna work eventually because it
Okay.
goes back to what I was saying
Yeah.
to you. You have to work in the business and on the business. So if you're working in the business, you have to do the skills. We spoke about this now.
Got you.
Those are the requirements to entry. You have to have the skill, the knowledge, the qualification. So whoever is at the clinic has to have that. In the beginning months, you can't afford to pay a professional nurse to do those things. So you'll be the skill that is at the clinic.
Got you.
Then you have to work on the business. We're speaking about compliance. If there was no NBS to do everything, then you have to at night, you need to sit down and comply and fill out forms and papers and do all these things. So if you have an employer on top of that, so you're working in the business, on the business, and in someone else's business as well.
Yeah.
So you
Yeah.
see, or it's not.
So
it
demands,
eventually.
the demand becomes
It's
so much.
too
It
much.
pulls you away from your one thing. Between the two, one will fail, and you wouldn't want your business to
Your
fail.
business to
you know,
fail.
if you're structuring. So I feel like if you really want to, you'll have to invest in your business.
Got you.
Yeah.
Got you.
And also
Okay.
you have to be ready financially. A lot of people will
Definitely.
do what you are saying because they are scared. They've got fear of the unknown.
Yeah.
They feel they don't have
is
financial
true.
capacity to start.
They are building to get out of it,
What if it fails? I don't
Yeah.
have money. Where do I get? That's where we came with the NBS Kickstart Capital, which Lerato is going to be laughing at me right now. To think that this is going to be on the camera. Well, let me tell you.
Yeah.
We have
People need the support. People
Yeah.
need the support. Yeah.
No, business does not need funding.
Yeah.
You need to sell.
That is
That
true.
is what business
But
needs.
kickstart.
You need to sell.
Kickstart.
You need to
Okay.
start selling.
So
Sell.
you know, okay, let me just be honest
Yeah.
here
Okay.
on
Okay.
camera.
Cool. Got you.
we do have a kickstart capital that is set aside to support our nurses who
Yeah.
wants to start.
Okay.
And get that kickstart is not coming to you as money.
Yeah, cash
Yeah.
You
money.
would go and do some quotation if you want your bird, the
Yeah,
equipment
yeah.
that would help you to start. We have given out, I think, 4 members already because we have launched about 4 clinics.
Yes, yes.
That's
And
beautiful.
to tell the truth in front of the camera, it's only one person that disappointed us. The other 3, I don't want to mention their names, but they are still operational. They are still working.
Nice.
And I'm very happy to see the
Nice.
progress on a daily
Yeah.
basis. They report back
Yeah.
and they give me good feedback,
Yeah.
and I'm so happy, and that keeps me going.
Yeah.
To say I have helped someone, but then it's only one person.
So if somebody, if you give them the kickstart, right, and then the business maybe doesn't work out or anything, do you then go back and take the stuff?
No, truly speaking, with the current structures, with the companies that have joined
Yeah.
the company, NBS, to
Yeah.
structure and to have, I
Yeah.
think we are talking more about that.
Oh,
You understand?
okay. So if it's not
we
working
don't
out-
If it's not working out.
we don't. We help a lot. Remember, as NBS, we also help into launching, marketing. We come and do awareness.
Yeah.
So we will go.
I
get
will Mr. K
clients.
there. They're holding speakers.
Yeah.
Come to the clinic.
So to
It's very nice.
say,
Yeah.
it has never been a thought for us to believe in failure.
Yes.
To say
yes.
it won't work.
Yeah.
Because we try by all
Yeah.
means. We're still going to go to a clinic and do awareness out of a clinic.
Beautiful. Yeah.
To talk about this, because we do this with no fear. It's allowed.
Yeah.
It's allowed. We've got sections 22. We've got South African Nursing Council certificates. And the good thing is that nowadays, SANC, when you pay for your membership, they ask you for your practice number. That new form, it asks you for a practice
Oh,
number.
okay.
So in other words, they're asking you, they're actually like putting it there that you can go and be a businesswoman. You can go and have your own practice, So Lerato, what were the most challenging factor
Yeah.
in your clinic when you started? Like you are working as a midwife in a hospital. You've got a stable job. You are getting salary every month. You are working.
Yeah.
And then now you want to go and start your own thing. What was the challenge? What were what was that one challenge that came to be a problem?
Yeah, I was comfortable, obviously. Working as a midwife,
Yeah, you had
everything.
that comfort.
I've already established my routine in life and whatever. And yeah, like I'm doing nighttime, the daytime I'm there. It's still a mess that time, but then I was like, I'm gonna risk it all for you, for the clinic. I was like, it's very weird, risk it all for you.
Sorry, have you worked in private
So
hospital, in government hospital?
In government, yeah, I was working at a maternity obstetric unit.
Okay.
Yeah.
Did you work in private as well?
No. I
never
started.
been in a
I
private?
went in my own private.
She went private.
I went private.
Wow,
And then the barrier to entry was that the red tape. That time we hadn't figured out the system, so I was not sure where to get the practice number, where to get the permits, where to speak to who about what.
Wow.
So I was not really aware. All I knew is that I have this passion, I have, this drive, and I want to merge my two passions together. So that was one of the things. So when I went into practicing, then I stumbled across groups like Woody, SPNP, then I went into, so those
without
are...
knowledge. Yeah, you just. I'm also
so
part
those
of
are,
it.
that is where I got my mentorship. That is where I got my recognition. That is where I got, some of the streamlining of things. And then all along the line, you just meet people who are doing practice. Like the information was so well kept, felt like a secret or gate kept. But then when you go into the market, you actually establish that people. Like no one's gonna tell you what they do on in their business. But then once you're inside the business itself, then I can speak to you about it now. So, but then it's who are you for me to just give you information in J just like that?
Wow.
So you need to show interest. So that is what I was doing. I
A lot of
showed
people
interest.
who are in private practices are very private.
Yeah. And then
Really?
it was just they were just living their life and pushing their thing. It's not even a secret or anything. I just had to know who to speak to and call them and say, "Kina Sister Lerato." I remember my first mentor, Sister T. I just called her. I just randomly got her from SPNP group, And I just called her and I said, you know what, I'm new in this field. I don't know who's the suppliers or where to get
Yeah,
even
things and all
Biko.
of that, yeah.
You know, then she's like, no, girl, don't worry. I will come and guide you. So she's been my mentor ever since then.
Shout out to
Come on,
Sister T.
Sister T.
Yeah.
So that is the first person I stumbled across. So that is the first thing, knowing where the compliance wise. I'm glad that you're in the space where you clarify that whole process. That is part of the reason why you need to join NBS so that you
Wow.
don't have
Look,
to
we
go
like
through
join
what I
NBS.
went through
Exactly,
because they are there.
You realize
The
that a
second-
lot of people went through the same
It's
issues.
the same, really,
and-
because that is what she's
yeah.
trying to solve as well. Because,
Exactly.
But then that is what gives you the thick skin as well. So if you, that's why I carry. So that is that is what gives you
It's
the.
painful, eh? Though it's painful. It's fine.
Sorry. The second thing, which also she's trying to solve, is the access to finance,
Yeah.
funding.
Exactly.
You know, so you obviously have to put your job on the
The
line.
pipeline, yeah.
You probably use your pension fund to fund your
Provident and
life.
all of that, yeah.
You know. And then after a while, things start failing because it will fail.
Eish.
That is just how it is. It will be very hard for you to even have 50 patients in that first month,
That is
let
true.
alone 20. Sometimes even 10 is impossible. So that is just the reality of it. You spend a good 2 years trying to figure out the system. In the
Yeah.
2 years, you'll probably be making peanuts in there, and then it has a lot of
That's very
overheads.
true. That's
Get
very
it,
true.
like, I'm not
But
trying to
also
sugarcoat it.
Locations
That's
are very
very true.
important, isn't it?
Yeah,
when you
it
open the
depends on
practice.
all of those things. The way you're situated, who's your market, what your prices are. Are you taking medical aid? Are you do so? I set myself up. It must be a space of clinics. It must look nice. It must be in a retail center because this way I want it to go first. You know, that's the market I wanted to break in. Okay, this is where I want to.
Got
Because
you.
I am trying to solve a problem here, private and public. You know, it's hard for people babaling private health, babaling the medical aid to get access to basic things.
How long did it take for you to break even? That's if you are breaking even. I believe you are.
Yeah.
Yeah, with the fact that
The,
it's
the
partnered with the
Louis Vuitton is saying
No,
something.
international partnership.
Yeah.
Hello.
Yeah. This was bought for by one of the other business, but yeah. The
Okay.
clinic
Okay.
for the clinic to even make it to break even, it probably took about a year.
Okay.
Oh.
Yeah,
All right.
it probably took about a year.